from the Asian Community Development Council. This is Family in Focus, Mondays at 12 noon on PHLV Radio.
Hi, everyone. Happy Monday. Welcome back to Family in Focus, a podcast brought to you by the Asian Community Development Council, or ACDC, a nonprofit based here in Las Vegas, Nevada, helping to educate, empower, and connect the Asian American Pacific Islander community throughout the state of Nevada. We're also here on PHLV Radio. Happy to see all of you here on this Monday morning. We're talking about something that's actually very relevant, very current, happening today, which is enrollment. It actually is open enrollment starting today if you want to get your health insurance through Nevada Health Link here. If you're here in Nevada, it starts to, or if you're listening to this anywhere in the country, this is open enrollment for people across the country as well. November 1st. This is the big day, and a lot of people have questions. They want to know, wanted to get on the best plans that they can afford. So we're here to answer all those questions today. We have some great guests in the studio with us. We have Rosa Alejandre, who's joining us. She's the Navigator Program Manager with the Silver State Health Insurance Exchange. Rosa, great to have you with us back in the studio.
Thank you, Petrania, and good afternoon to you too.
Good afternoon to you as well. And we have Joy Avendano. She's actually a health navigator with the Asian Community Development Council, and Joy works very hard with the community to help them connect them with the right plan. So good to have you with us.
Thanks for having me
in studio, Joy. And we have a couple of guests on the phone with us, so we're going to bring them in as we ask them some questions because they actually have benefited from ACDC. They work directly with someone like Joy to get their health insurance. But we have Rosa with us today. I'm going to start with you, Rosa, because open enrollment, we've been seeing this on TV. People have been talking about it. This is really important, especially coming off the pandemic. People are really thinking about their health and making sure that they're covered with the right health insurance plans for them. So explain this. If people are just kind of new to this whole process, open enrollment, what is this all about?
Well, open enrollment, what it is this is a time that anyone can apply for health insurance here in the state of Nevada. And Nevada Health Link is the portal that the state of Nevada, Silver State Health Insurance Exchange, we run that online portal, and that basically allows any Nevadan that qualifies to go ahead and enroll in health insurance. Now, that health insurance will start the 1st of January, but open enrollment starts November 1st through January 15th. And what that means is that if you enroll now, between now November 1st through December 31st, you can actually have coverage starting January 1st. If you enroll between January 1st and January 15th, it will start the 1st of February. But right now is the time that anyone can come onto the marketplace, explore our carriers. We have over 7 carriers, over 126 qualified health plans to choose from. We have 6 dental carriers, and we also have a network with VSP for vision plans as well. But right now is the time that you don't need a qualifying life event. For example, you just moved here or you just happen to lose your health insurance. Open enrollment means anyone that qualifies can go ahead and shop the plans right now so that they're ready for the next year and make sure that they're covered for the next year as well. Again, always remembering to make sure you make your payments because that's what makes it effective, right? We always go and enroll and then we forget to make the payments. We got to make sure we make those payments to make sure we have coverage. But that's what open enrollment is. Right now is a time for any Nevadan that qualifies to go into NevadaHealthLink.com, look at your plans that you have right now, and maybe even explore other options that we have available. We now have 2 new carriers, so in total 7 carriers on our exchange, which is wonderful for us. We've never had that many since the inception of the exchange, and I've been here since 2013, so it's really exciting. I've seen some really good premiums in there, and again, with open enrollment is the time to shop right now.
And it can be a very overwhelming process for so many people. I mean, you just told me there, close to 130 qualify health plans out there, so different options, but
Yes.
that's the beauty of it too, right? Because people have all these different choices that they can look whatever fits their lifestyle, their situations, their circumstances is best. But what I think, when it's so many plans, I think what they need is the help of people like you, and people like Joy at ACDC to help kind of decipher this. So what's the first step? What do you want people to do first just to kind of not feel like they're so overwhelmed?
As you did mention, Petrania, health insurance is a complicated issue in English, let alone in another language, right? But we do have several grantees. We have 7 grantees in the state that can assist consumers either in person or over the phone. ACDC is one of our grantees, and I I really love that they are such a community project, program based, and they reach out to all consumers. You don't have to be only AAPI. They will assist any consumer, and that's really great about ACDC. But what we have with ACDC here is that if a consumer is really not sure what they need or what something means, we have navigators. These navigators are licensed by the state of Nevada. They're trained. They take courses through an outside vendor through the Department of Insurance, as well as a training course through Nevada HealthLink. So before they're helping consumers, they are really versed in insurance, at least for Affordable Care Act. We also have brokers and agents that can assist consumers. But the main focus right now is ACDC, as we're working with this program here, is that all the service they provide is for free, and it's just basically to give you the options that are available. And if a consumer has a question, I don't understand what's a deductible, what's a copayment, that's what we have our navigators here for, to help you walk you through that process. And they don't have to feel that pressure that just because they assisted them, they have to get something right then and there. You have the option to look over these plans. As I mentioned, there's 126 plans to look over, and it could be overwhelming. It may take you a little bit to look it over, but we have someone trained and certified to help you do that. So any questions they may have, they can definitely reach out to us at NevadaHealthLink.com or even through ACDC. And many of ACDC consumers, they're repeat consumers because they appreciate and they love the support that they get from ACDC. Open enrollment comes in, and they're there ready to help them.
And that's what's great. And Joy, talk to us a little bit about this, because you and your team at ACDC have been really working to get the word out, right? Because a lot of people don't even know that this was coming up. So talk to us about that, what you do there to help the community.
You know, just talking about open enrollment, to add to what Rosa said, beginning October, Nevada HealthLink filled out letters telling them your application has been renewed for 2022. They started calling me. And my appointment notebook for November, for the first 2 weeks of November, is filled up because they're excited to renew, to learn about the new plans. And I told them we added 2 new insurance carriers and there are more plan benefits. They're excited. So right now, up to next week, I'm filled up. My notebook has been filled up with appointments back to back.
That's great. I mean, that's what we want to hear. And Joy,
Right.
so what do people do? So they know you're at ACDC, and I know a lot of people reach out to organizations like ACDC because of the language help, right? I know you speak Tagalog. You have a partner who speaks Vietnamese. How does that help? I mean, obviously, like Rosa said, it's such an overwhelming process, but knowing that they can reach someone who can help kind of translate all these terms really do help, right?
It helps a lot. Like the Vietnamese community, in the beginning, our Vietnamese health navigator, Yim, is saying that her people don't believe in insurance.
Oh.
But look at her. She enrolls a lot.
Yeah.
It's her magic.
Yeah, totally.
So that helps. Some are needing interpreters, like Chinese. We have Chinese people in the office. Some are Thai. We approach you. Tagalog people, they can understand English, so there's no problem. But they usually pass on the Tagalog speaking to me, right? So, you know, there's confidence level in there.
Right. It's not just the language, because it's a cultural thing. Like you say, with Yim and the Vietnamese community, maybe they're not quite sure. They've never had health insurance ever, you know, so they come to this country or maybe new to this community. They're like, why do I need it? And so having people like Yim there just kind of really explain the process.
Right. It helps. It helps a lot.
Yeah, and it does. And I know your appointments have been booking up. And we do have some guests who are on the phone right now, and they work directly with you. And I'm going to start with Caroline. And Caroline de Guzman is on the phone right now. And Caroline, you just moved here recently from California, right? So how did you even hear about ACDC?
I don't have any idea about ACDC. So there was a friend that I met before who is acquainted with Joy. So it so happened that I'm lucky to met her over the phone.
Right.
And she was the one who introduced to me like this insurance and everything. And oh man, it's a blessing.
Yeah, and tell me about that, because you just recently had surgery. So without health insurance, that would have been a really difficult situation, right?
Yes. Actually, the doctor told me that I need to do this surgery. So I was without the help of Joy, I won't be able to do it as soon as possible, because It's so expensive, and I'm new here in Vegas because we just relocated here.
Mm-hmm.
So it was really a blessing that I have this insurance offered by Joy.
Yeah, and I
So I was
know.
able to use it sometime in September this year.
Right. And this is so important. And you mentioned the fact, Caroline, the fact that money is a big issue. People really thinking about that. And Joy, talk to me about your experience working with our eight other consumer here, Estrelita. What was, kind of that relationship? And then we'll ask Estrelita to chime in. How did you work with her and what kind of help did you give her?
Fortunately or unfortunately, she had some health challenges of her own, and she would call me like, I need this, I need this, I need this. And then even with appointment with the doctor, if she cannot explain it very well to the secretary,
Right.
I would help her.
Wow.
I would help her.
Yeah.
And then she had breast cancer, and I think she had osteoporosis problem too.
Yeah.
So
she reached out and talked to you about that. And Estrelita, I know you have on the phone. How was that experience working with Joy and was for her to step in and to help you?
Very nice. I like Joyce every time I have a problem for my oncology, for injection for my osteoporosis. That's every time, either me, my family experience like that. Why? I said, of course, I understand because my insurance is only the pass is $23 I pay. But because I said to me, Joy, no problem there. Just number one, you are already go to the doctor every time, and just only the insurance like that, and then I believe Joy because Joy is so nice, and sometimes
thank
I
you.
cannot understand that they say to me, and then I will transfer to Joy.
Yeah.
Joy, can you explain for me this one? Yeah.
Yeah,
That is
that's
my experience for Joy.
that's great to hear
I'm
that
not
from
a
you.
fluent English, just only I can understand, but
Yeah.
most of the time I ask Joy.
Joy's been has
explain
been
to
your
me.
helper. No, that's great. And Rosa, this must be good to hear. Just like these are the kind of experiences and stories that you do, that you work for, that you hope to hear because you want to make sure people have the health insurance they need.
Exactly. And this is the beauty about Affordable Care Act, and that many people still don't realize. Pre-existing conditions don't matter with us. Whether it's cancer, whether it's diabetes, cholesterol, many people think, oh, that's not so major, but actually it is, and it requires medicine on a consistent basis. And so that's the beauty about the Affordable Care Act, that we're able to help consumers no matter what their problem is, and no matter what mental situation, what health situation, it doesn't matter. We provide a full comprehensive plans, and it's just up to the consumers to come and look. And again, this is why we love working with ACDC. They're in the community, they're able to build that rapport, and we hear the results with our consumers, how happy they are that there was someone able to assist them.
So now we're starting today. November 1st is the start, goes on through January 15th. So the people who qualify, overall, these are people who, in general, who don't get health insurance through their employers, right? So can you kind of lay out who qualifies for this?
Sure. So Nevada HealthLink is here really for those that don't have health insurance through their employer, Medicaid, and or Medicare. So if you don't have any health insurance or health insurance is not offered to you, we are a great option. Many people think that we may be a private insurance. We're not a private insurance. We are a state-based agency. We are the catch-all for those people that do not have health insurance for whatever the reason is. We will screen you and see if there's something that we can do to help you with Nevada HealthLink. Now, if you don't qualify with Nevada HealthLink through one of our QHPs and you may qualify for Medicaid, we can also assist you with that application as well. So we try and make sure that our services are a full wraparound. There's no wrong door with Nevada HealthLink. There are some people that will come to us that are also undocumented. Unfortunately, at this time, we cannot help them, but if we can send them to either a nonprofit clinic like Nevada Health Centers, First Med. You know, we have several of the federally qualified health centers that can help people regardless of their immigration status.
Right.
It is all based on their income, and they'll go sliding scale. So we may not be able to help you, but if we can refer you to someone that can for medical access, we definitely will as well.
Yeah, and it's just so, it's just great for informational we're getting out there. We're just kind of tuning in and listening to us right now. We have Rosa Alejandre with Nevada Health Link, and we have Joy Avendano with ACDC. These are the people out there in the community getting people to know about this open enrollment. If you need health insurance and, maybe your family don't have much information or even resources, financial resources, because Joy, you've helped people who at the end don't really have to pay much in premium and still have help, because people are thinking, I have to spend all this money per month to have health insurance, but there are ways to do that without having to spend a lot of money.
That's true.
Yeah.
Just this morning, I got a call from a client during the ARPA, the American Rescue Plan. He delayed his enrollment. This morning he called me. He just got hospitalized with a $12,500 bill.
Wow.
And he couldn't afford it. So I said, okay, we'll see you tomorrow. We'll enroll you.
Wow.
Yeah.
Yeah, and Rosa, people are not having to pay. I heard 13 cents they pay for their premium. You told me.
I actually was just talking to one of my navigators that a consumer, they previously had a $0 premium for 2021. They came in to shop today, and their plan did go up quite a bit, so they looked for another carrier, and now that premium will be 13 cents.
Wow.
I mean, how can that not be affordable? And again, I know.
And how is that possible? Like, people are thinking, how do I just pay 13 cents and be able to be covered for health insurance?
And the reason it's possible is because we have what only Nevada HealthLink can give, which is federal tax credits. So if it's called advanced premium tax credits, and also subsidies. So depending on your FPL, meaning your federal poverty level is what it's called. It's the basic guidelines that we go by. So dependent on that, you may even qualify for two types of subsidies, which is the advanced premium tax credit and a cost share reduction. That is how consumers can get these type of premiums. And again, we know that most of our consumers, I believe it's an 85% of our consumers enrolled that get some sort of tax credit available to them.
Yeah.
So, and that definitely helps the consumer paying the premium. What we want to make sure is that if you come to us and if that premium is too expensive and we've explored all options, we've at least given you that opportunity to look at. We know not everybody's budget can afford, perhaps to them, health insurance. We just want to make sure that you understand we are the resource for you. We have subsidies available, and it is affordable for many, many people. And we want to make sure that you understand. Being without health insurance, just like one of our guests mentioned here, I believe it was Carmen, she just had surgery.
Yeah.
Without health insurance, sometimes we think it's too expensive to pay this premium, but without health insurance and you get yourself in a situation where you need surgery on an emergency basis, that bill is going to be much more expensive than your whole premium the whole year.
Yeah, and let's bring it back, Caroline de Guzman, who, you said you just had surgery a few months ago. Just think about if you did not have health insurance, how would that have been impacted your family?
I know, because we've been talking about it. My husband was saying, good thing we have this insurance introduced by Joy. So, and I was like, okay, that's good to know, because without this insurance, because I'm new here in Vegas, and we're thinking about where to get health insurance coverage. All the company offers health insurance, but of course you're looking for, where you won't pay much. So after the doctor told me that I needed surgery, so without hesitation, I'd go for it, because I know the health insurance will help me a lot.
Yeah. And Estrelita, for you as well, I mean, you have health challenges, and this is something that obviously a big part of your life. You want to make sure you're covered. How important is it for you to have this and to be able to find, ACDC and got help getting your health insurance that way?
I found ACDC when they said to me the Medicaid, the Medicare. They said to me they don't continue again the Medicaid. Why? I said my what call this, my income is so lower. Why you are working? They said to me, the welfare.
Right.
Okay, okay, it's no problem to me. If you have a recommend to me, they give me a paper, and then somebody I ask the I think the auntie of my client. You call this one, that one Asian community development. Then I call, and then the one who the answer with me with joy, and then I said, "Are you Filipina?" I said, "Yes, I'm Filipina." And then we had story. Oh, I told her, "Oh, you know that that is I help you." Because the last 2019 between 2020, I said I'll go to my doctor. I have no insurance already. I said you wait, and then Joy contact the health plan of Nevada, and then he transfer me every time that the welfare of Nevada, and then I said okay. You understand it? Okay, okay. And then we agree. That's the point that I meet Joy and ACDC.
Yeah, no,
That
Estrelita, I
is
think,
the story of me.
yeah.
And then until I have no work, June 2020, I said, Joy, I leave my work. Oh, where are you leaving now? And Joy told to me, that's my friend. I said, oh, kawawa ka naman. They say, you are so, it's okay. I applied again, I said. And then to continue, that said, oh, I'll go to Andrew to apply for citizenship. That's it. That is the best God to me.
Yeah.
I meet Joy with the phone and Andrew.
You know, that's
That's what
great.
I
And
know.
yeah. And it's so great to hear, you came to Joy and ACDC for One Help, ended up getting so many other things. And Joy,
Yeah, so many other things that they
that
helped
they
me
helped
with.
you. And Joy,
Yeah.
tell me about what people need to know before they call you. Do they have to get paperwork ready? What do they need before they even
Oh,
call
we
ACDC?
interview them first
Okay.
as to their eligibility.
Yeah.
First, they have to have lawful residency, and then I ask them about the size of their family, the family income,
Right.
because there's an income threshold, right? And from there, we go. If they're eligible, we set an appointment with them, and then we enroll them.
Yeah.
Yeah, we ask them to bring their papers.
And you said your calendar is filling up. So if people
Yeah,
need
it
help,
is.
they need to call soon or email.
For appointment, even if we're working from home, we do Google Meet
Oh, wow.
or just on the phone.
Yeah.
But I would prefer that they go to the office, come to the office, because I show them the plans to choose from, and the computer is facing them.
So, and for people who don't know, we have two offices here in Las Vegas, and they can go to both, or do they go to
Only to Shanghai
the
Plaza.
Shanghai Plaza? And we'll put that address up, and then we'll put it on the website as well if you're watching this and you always go to acdcnv.org, right?
Yeah.
The website, and also healthcare at acdcnv.org to make an appointment. With Joy. And Rosa, people can get more information on your website as well.
Oh, yes, most definitely.
Yeah.
If they go to www.nevadahealthlink.com, they'll find our website. They can call our call center. We're open 7 days, actually, 9 to 5. They can call our call center at 1-800-547-2927. If they go to our website, they can also look for someone directly. And they just got to go to our website, click Find Assistance. They can type in their zip code, and it'll find someone closest to them, or they can even type in ACDC, and it'll get someone at ACDC, a navigator for them as well.
And how long is the process? I mean, if people jump in tomorrow, look for their plans, how long does it take? And then when does it kick in?
So how long it takes can really depend on the household size. Really, that's what takes the longest, because we have to submit every person that's on the application. So let's say it's a household of one, you can do it really within 30 minutes. If it's a household of two or more, I would say anywhere between 45 minutes to an hour if you're going to a navigator, just because you start talking and then you have other questions that follow up, just to give you that good amount of time to make sure that you go over all of your questions. So I would block myself at least a good hour. If you're new to this, maybe even an hour and a half, just to make sure you get all of your questions answered. Now, when does it go into effect? Again, open enrollment starts November 1st through January 15th. But if you enroll between November 1st through December 31st, you will have effective date as of January 1st. If you enroll from January 1st through January 15th, it will be effective February 1st. Again, that's making sure that you make your premium payments as well.
And just to clarify for people, even if you have insurance right now, you want to change, this is the time, right? Open enrollment is when, even if you have insurance, you can make changes, even if you're not going through any kind of big life changes right now.
Exactly. This is a time to definitely go into your account, review it, make sure that the plan that you have is the best plan that is available for you. You may find that perhaps the premium you're looking at is not feasible for your budget. Take a look. We like I said, we have 126 plans. I'm sure you will find one that fits your budget.
Yeah. And Joy, any other advice you have for people before they reach out to you? What do you want to get out there to the community that ACDC can help them with?
Oh, first of all, when they say, I want to keep my plan, don't stop there. Explore the options, right? Because there are changes all the time, every year.
Right.
So, yeah. And I encourage them to change your plan if it needs be, right?
Because a lot of people just stick with what they know because they feel, oh, maybe that's the best one for me. I don't really have time to look at all these plans and see if they fit, right? So, but it's important for them to look at the details.
Of course, yeah.
Yeah.
Most definitely, especially with premiums, because you just never know. You may be thinking you might set in an auto draft and your payment's coming out and not even realize, oh, my payment went up. Again, we are right now, because of ARPA, which is the American Rescue Plan Act, they are extending subsidies where there's no cap at the 400% federal level, meaning no one will pay more than 8.5% of their annual income for premium. So right now is the best time to come in and look at our premiums.
And that's the thing, if people are watching their budget right now, which a lot of people are, you know, you want to make sure that you're getting the most help when it comes to your health insurance.
Exactly.
All right. Well, thank you so much for both of you, Rosa and Joy, for joining us on the show today. And thank you to our guests who are on the phone, Estrelita and Caroline, joining us to share their stories of getting their health insurance with the help of ACDC and Nevada Health Link. And again, if you want more information, you can always go to their websites and also to acdcnv.org. A lot of information on there. People like Joy waiting in line, Rosa as well. It's going to be a very busy few months for you, but I know that this is a great time, especially for people needing health coverage and don't know where to turn. This is the first step that they can do. So thank you for all of you for joining us on the show today, and thank you for listening and watching Family in Focus, and we'll see you again next week.
Thank you.